Hello everyone. This is the ABG series scenario 5 brought to you by the Medicine Project. Let's have a look at this unique case. So, a diabetic female was brought to the emergency with complaints of abdominal pain, vomiting, and fever. The patient was tachypneic and dehydrated but conscious. Pulse was 110, BP was 100 by 70. On auscultation, the chest was clear. Random sugar was 268 milligrams per deciliter. The patient was admitted to the ICU, and investigations revealed urine ketones to be positive. So, the ABG revealed the following. So kindly look at the bicarbonate, the sodium and the chloride levels carefully. The PaCO2 is 28 and pH is 7.48 in this patient. So what is the ABG disorder and would you still infuse insulin to this patient? Let's find out. So this patient is a case of high anion gap metabolic acidosis with metabolic alkalosis and respiratory alkalosis. If the answer seemed confusing, it was because of the concept known as delta gap. If we observe carefully, the pH is alkaline, but bicarbonate and PaCO2 both are low. Superficially, it would appear to be a case of simple partial compensation, but if properly assessed, we'll notice another entity, that is the anion gap, which is significantly higher, around 24 in this case, based on the formula that I've mentioned here. So basically the anion gap represents the unmeasured anions like keto acids, phosphates, etc. Under specific conditions, when the acids enter the bloodstream, they are neutralized by the bicarbonate. So therefore the anions remain in the blood, but the bicarbonate is used up. Now, if there is excessive presence of these acids, there will be exhaustion of bicarbonate after some time, causing acidosis with increased anion gap. Now, if it were a case of pure decay or hagma, as it may seem, the rise in anion gap would have been equivalent to the fall in bicarbonate, which is not the case here. The delta Ag in this case is 12 and delta HCO3 is 4. So clearly the fall in bicarbonate is not as steep as it should have been. This means that something else, vomiting in this case, is preventing the fall of bicarbonate by enhancing its concentration in the blood, thereby blunting its fall. And what is the disorder wherein bicarbonate increases in the blood? That is metabolic alkalosis. So that's why this is a case of hagma with respiratory and metabolic alkalosis as well. And yes, insulin would still be given in this patient to clear the excess anions and prevent a full-fledged acidosis. I have mentioned a quick tip in the comments. Please like and follow. Thank you.